A very good evening to one and all present here. Wishing a wonderful evening. Welcoming you all to another interesting session of I Ask Ayush. I take immense pleasure in welcoming the chief guest of the hour, Dr. S. Madankumar, BNYS, MD in Acupuncture and Energy Medicine, MBA in Human Resource and Management, and MSc in Psychology. Sir is presently working as principal of Sona Medical College of Naturopathy and Yoga Science, Salem, Tamil Nadu. He has worked as professor in Department of Yoga in Sant Hridram Medical College of Naturopathy and Yoga for Women in Bhopal. Sir has also been a junior naturopath in National Institute of Naturopathy, Pune. Sir has been a lecturer cum medical officer in A.L.N. Rao Memorial Ayurvedic Medical College, Koppa. It is my honor to welcome an expert in therapeutic yoga and nutrition and dietetic lifestyle disorder. Welcome, sir.
Yeah, thank you. Thank you so much, man.
Keep your eyes and ears open if you desire to get on into the world. Douglas Gerald. In this developing era, along with much developing scientific techniques, our eyes is undergoing the much strain. As per the survey conducted in India in 2019, around 6% of the population is suffering from eye defects. Usage of computers and mobile phones is causing watery eyes, dry eyes, and eye strain. We could even see a 5-year-old child is suffering from eye defect. In this busy lifestyle, we are forgetting to take care of ourselves and an important organ, eye. Even we have classical references in Ayurveda regarding eye. Today, the very important need of our daily life is we are going to see. That is, we are going to see yoga for eye. Yeah, you heard me right. It is yoga for eye. It is interesting, no? So I am also interested as you. Without much delay, let me handle this session to Sir.
Yeah, thank you. Thank you so much. So the topic, as she said, is it is yoga for eye care. So eye care, mm, in human body, there are several organs, as you all know, but one of the very delicate and very sensitive organ we can say is our eyes. And equally, we are doing so much of non-violence. I mean, violence, not non-violence. It is violence to one particular organ is our eyes. That to post to this COVID, due to during the COVID, even before COVID also, as the mobile phones, the Android mobile phones came into existence in a full stream. Since then, we are doing, we are really doing so much of violence to our eyes, knowingly. Few people knowingly they are doing, few people unknowingly also they are doing. So as I said, it is one of the very sensitive organ in our eyes, in our body, is the eyes. So eyes are very sensitive. Why I'm saying is it has very tiny musculature and tiny blood vessels. So that's so in any non-communicable disease, this organ also affects equally. For example, taking diabetes or hypertension, the people used to get eye problem also along with those non-communicable diseases by free of cost in case if it is not under the control. So such a very delicate organ we have, very sensitive organ we have, but we are not taking much proper care for that in day-to-day life. Starting from any age group you can take, any sex or any country people you can take, they are not giving much proper care to their own eyes. And just a minute, in case if I want to share any PPT, can I share? Is there any options over here to share? I think Is it audible to all? Can anyone say, is it audible? Just a minute.
Sir,
Is
you're
my
audible,
audio,
sir?
yeah, audible? So in case if I want to share my PPT, how can I share it? Can you guide me or help me in this?
Yes,
Or
sir.
we
One
can't?
second, sir.
Yeah. In case if it is not there, the option is not there, we can go ahead.
1 second, sir. Okay.
Yeah, yeah.
Sir, share button is there, no, sir. You can use the share button.
No, it is not visible for me. Share option itself is not there here. Video, audio, and virtual background is there.
Sir, sir, it is third button in your
Just a minute.
up upper and
Yeah, just a minute.
like one upper arrow mark. You're having a button, no, sir. Third button.
Yeah, three buttons
You
is there, but
by using that you can share the pictures, sir.
no, anyhow, it is not visualizing in this. It is not visible in my screen. So I tried. So only chat icons are there, private chat is there, and the people I can able to visible see. Okay, anyhow, no issues. We can go with this.
Yes.
No. So coming back, I had a PPT, but I'm not able to show you. I can say there are very delicate structures, the muscles around the eyes, so around the eyeball. So the rectile muscles, we can say, or rectus muscle, they will say, okay, in singular. So rectus is, there are nearly more than 6 muscles around the eyeball, each eyeball. One is inferior rectal muscle and the superior, superior and inferior. Then the lateral and the medial, and superior oblique and the lateral oblique. So this 6 group of muscles for each eye works in
Excuse me,
coordination
sir.
to give any movement.
Sir, could you
Yeah.
share the pictures in WhatsApp, sir? We can share
Um.
from this side.
Okay, I can share you on the WhatsApp to you. Just a
Yes, sir.
minute.
Yeah, sir. Thank you, sir.
Actually, I shared the PPT of mine to the
Okay,
WhatsApp
sir.
to a sir who shared the link to me.
Yeah,
So
sir.
that
Got it, sir. Sir
okay.
will now present it.
Okay. Thank you.
Thank
So these 6 group of muscles works in coordination for contracting the eyes, for retracting the eyes, for inward movement, outward movement, for a cross oblique movement, or for even rotational gazing also. These 6 muscles helps for each eye to work in humans. So these are all very, very short and delicate, tiny muscles, thin structured muscles, we can say. So very soft in structure. So for all the day-to-day activity from morning till night going to bed, what are the objects we are seeing, either it is closer objects or a far away object, it might be a multicolored object, it might be a black and white or any bigger and huge or whatever it is, the pixelates might be anything. So for everything, these muscles helps us to contract or to shrink or retract the eyeball and make a clear picture for us and explains us through the brain nerves everything it is doing. So for these eyes, we are giving very less rest only throughout the day. Once upon a time, For example, before the Android phones or before the color TV comes, even we can say, before the high technology came into existence, we gave enough rest to the eyes, truly speaking. But in the present world, we are giving very less rest and relaxation to the eyes. So to give the proper rest or to give a proper care through yogic medium, there are several practices we have. So in that several practices, I selected very main and few practices here. So that is what I'm going to share with you today. So the main and first and foremost practice is Chakshu Dauti, we can say in the yogic term. Chakshu Dauti, it is for the eyeball or the eyes, we are going to cleanse. Cleanse with a small eye wash cup. That is what named as Chakshu Dauti, they say in yogic terminology. So in modern perspective or a lateral perspective, we can say it as yogic eye wash. So how to wash the eyes? It is not just splashing the water over the face or splashing the water completely through the eyes or with the full pressure, giving it the water splash to the eyes. No, not that way. As I said again, eyes are a very delicate and sensitive organ in the body, so we have to take care of that very carefully. So we have to wash the eyes very gently. So we have a specially made eye wash cups which are readily available even nowadays in the normal medical stores. Medical store people we are getting, so pharmacies we are getting. So just we have to go and ask eye wash cup. So it is coming in both transparent and translucent types also, even in at times in different colors also is coming. So at times ceramic also it is coming, plastic also it is coming, fiber optic also it is coming. So anything you can use, just for a minute you are going to wash the eyes with that cup. So you have to purchase the cup. Well, after getting the cup, you have to fill the cup with a clean drinking water. It should be clean drinking water with a room temperature water. No need to go for cold or ice cold water or a hot water or a warm water. It is a normal neutral water. We can say even room temperature water, clean and drinking water you have to use. Fill the eye wash cup with that water and take it completely, fill the water and take it closer to your eyes. So after taking closer to the eyes, you have to keep the rim, the opening of the eye wash cup, you have to keep it closer to the eyeball. Select any one eyeball first, either right or left, your choice. So you have to keep it closer, tilt your head slightly down, keep it closer. Don't give any pressure to the eyes like keeping it completely in full contact or tightness. So the eyes should be touching the water. After opening the eyes, the eyeball should touch the water. So for that, keep a gentle contact of the eye wash cup towards the one particular eye. Then after making a perfect contact with the eye without any discomfort, slowly you have to open your eyes and close in the water inside the eye wash cup. So as I said, for 1 minute you have to wash for one eye. So it is in 1 minute you can do 100 blinkings also, even more than that also people used to do. But I don't want that. You have to do just 20 blinkings in 1 minute with one eye. So you can see for 1 second or 2 seconds, one blinking you can take. Okay, 2 to 2.5 seconds you can take one blinking. So in that ratio, you have to go for 20 blinkings. Slowly you have to open your eyes and keep the eyes open and keep inside the water of the eye wash cup. And then after 2 to 3 seconds, you can close the eyes. Again, open and maintain for 2 to 3 seconds. Open the eyes and maintain and then close. This way, like 20 blinkings you have to do in 1 minute. After completing that, you can remove the eye wash cup from the eye near area. Then you can wipe the water. You can take the water in that eye wash cup. Then a fresh water you can take in the same eye wash cup, and you can go for the other eye. So the next eye, the same procedure. You have to go for 20 blinkings with the same eye wash cup with a different water, and go for the different eye, the other eye. So this way you can go on doing eye wash practice with both the eyes. So this is one time I said for the right eye, for the left eye. Likewise, you have to repeat at least 2 to 3 times in a day. 2 to 3 times in a single time in a day, you can say. Like for example, morning, you're doing by 6 o'clock. So you're doing with the right eye first time. Then you're completed 1 minute with the right eye. Now you're going with the left eye. So again, after completing with the left eye, go for the right eye one more time. So likewise, 3 repetitions, alternate eyes you have to do with the eye wash cup. So it's better the time is in the morning time to do instead of doing in the evening. So certain people may not have time or might have skipped the time in a hurry, so they can do in the evening time, but it is idle to do in the morning time. So the PPT is visible here. So it is in the third slide. I think everybody is able to see the PPT. So these are the common problems I have mentioned here. So common problems of our precious eye, we can say. So like in this, I have mentioned two categories, like rectification by yoga. So the other category I have mentioned is which needs a other medical interventions. So just a minute. So rectification by yoga, which we can do the eye problems, or like eye strain or dry eye syndrome. The common, very new and common problem in the present scenario is dry eye syndrome, and conjunctivitis also we can rectify by the yoga practices. And refractive errors, in that refractive errors also there are four types. One is the myopia, hyperopia, the astigmatism, and presbyopia. So in this, the myopia and hypermyopia, I mean hyperopia, can be, that is a near vision and the farther vision can be rectified very easily. So even a person who is wearing specs regularly can also, by doing yoga practice, can remove the specs gradually in a period of time. So we are doing with our students, trying with our students, even doing research on this particular refractive errors, the both short vision and the long vision we are doing at present in our college. So these are the problems we can rectify, whereas other problems which are all had categorized here needs really some or the other medical intervention, particularly surgical interventions is highly necessary. So I'm not here to say that yoga can do miracles in any sort of eye problems. I will not, because there are certain limitations with that. We can prevent certain eye problems from the inheritance itself. We can cure or eradicate the future generation to get the eye problems. But once they got such problems, they have to go for certain one or the other. It might be a tiny or it might be a large scale and surgical intervention. It is highly essential. So whatever are categorized in the top, the first one, rectifications by yoga, that damn sure it can be rectified. Even at, it might be at any stage we can rectify that. So we can go for the next slide. Next slide. Can anyone change the slide or the view? Okay, no issue. So as the PPT came in between, I started explaining this. Before I was saying you the eye wash. So eye wash I was saying that is Chakshu Dauti. So by doing that three times in the morning, early morning, it is ideal, very ideal. You can experience a fresh eyes by doing that every day. So throughout the day, we have several activities we use to see the mobiles, we use to see the laptops, computer, other electronic gadgets, TV, at times movies, theaters, and we used to travel in several transportation in a day at times, and we meet several people. We'll be exposing our eyes to several climates, at times completely AC, at times completely outside to the sunny. So in all the ways, external pollutants also, in all the ways, the eyes are getting disturbed on a regular interval. So by doing this morning eye wash throughout the day after you're going for a work or exposing to any temperature, your eyes will be always healthy. That once you started practicing the eye wash or the chakshu dauti, if you're doing, you can see the difference literally. So once again, I'm emphasizing the eye wash cup should be, it is already available in the medical stores. You can get that, you have to keep it closer to the eyes. With that, fresh, clean drinking water with the room temperature water. You have to go for eye wash for each eye for 1 minute. In 1 minute, you have to go for 20 bleachings. That is 20 bleachings around you have to do. So this is one particular practice. We can say the preliminary practice and very easy practice also. I can say easy and effective practice. Why I'm saying this means because you can do it anywhere in the world. Just a small eye wash cup you have to take carry with you. You can even keep it in your shirt or pant packet also. That much tiny it is. So nothing else you have to take. Room temperature water and a clean drinking water you can get it anywhere in the world. So wherever you move, you can do it. No hassles in that. So such a effective and very simplified practice is Chakshu Dauti. So that will help you to keep your eyes always healthy. And the second practice is eye exercises, we can say. So Netra Shakti Vikashak in yogic terminologies, we can say, or in literal way, it is eye exercises. Most of you people have known this or learned this or even practiced this. So it is nothing but there are certain anatomical movements available already present with the eyes. The upward movement, downward movement, lateral movement to the right, and medial movement and lateral movement to the left, and medial movement to the right. That is to the middle part of the body, and superior oblique, the muscles which are all available, which are all doing the movements, all the movements we have to do with the eyes. That is Netra Shakti Vikasha or the eye exercises. So the main procedure or the protocol, or we can say the rules and regulations for doing eye exercises, that you have to keep your head and back straight. Mainly, you have to keep your head and back straight, particularly, and do the eye movements as slow as possible. If I am saying to do eye exercises, go for upward and downward movement, within a minute, people used to do 100 times. That is totally wrong. That is completely wrong. That is not a way to do the eye exercises. As I mentioned in the very first word of the lecture itself, eyes are the very delicate and sensitive organs, and the muscles present around it is also very sensitive. So you have to go and do the eye exercises as slow as possible because it is not a huge size muscle like our biceps, so where we have to take the dumbbells and make it more strengthened. No, it is a very small muscle. We cannot go and press it and make it strength. We have to make it strength by do our gentle eye exercises only. It is very simple eye exercises, but we have to do it gently. So most of the area and most of the yoga sessions, they used to do it very fast to complete in the final way. So they will do it very fast, and finally they end up with eye strain, and finally they will end up with a headache also at times. Certain people to the extreme level, they will get tears from the eyes also by doing that because it is very delicate. So we have to do it very slowly. So when going for one particular movement, complete one particular movement at a time. So don't go for two movements at a time. So that will not give you a complete movement. For example, if you are going for upward movement, you have to take your eyes slowly and gradually to the up level as much as you can. So without hand support also we can do, and with hand support also we can do. So with hand support means with the help of your thumb, either your right hand or the left hand, with the thumb steady, you have to raise your hand up to the maximum level till you are getting the thumb's image in your eyes. You should not move your head up, only you have to move your eyes up and down. So that way you have to do the upward movement. For the same downward movement, you have to take the thumb downwards. Till the thumb's view is there in your eyes, you have to make the movement down. Once the thumb's view is not there, don't take the thumb beyond that area or beyond that level. Till that level, you have to move it down and view the thumb. At the same time, don't nod your head down. It should be straight in a line. Only the movement should be in your eyes and the thumb or the hand, you can say. So here comes the image of the eye exercises. You can see the upward and downward movement. The directions are placed in that. So in the picture, in the pictorial explanation, it is mentioned in the direction, but it is not mentioned that you have to do it faster. It is pictorial explanation only for a pictorial explanation, but you have to do it slowly. How slow you are doing, that much benefit, that much strength you will get with your eyes. For example, you can see me in the video. So I'm taking my hand now to the up. So you can see the hand movement, how slow I'm going. So this slow and steady movement you should have with your eyes also and with the hand also. The same movement you can complete faster this way also, but this will again harm your eyes. So you have to do it very slowly, take it very slowly to the upward and the same very slowly to the downwards also. First complete the upward movement, then go for the downward movement. So first the upward movement you have to go for, like you can take the hand to the up, your V should be with only the thumb, it should not go beyond the limit. Once the thumb is not visible in a particular level, don't move your hand beyond that, stop over there and come back to the normal straight mode. That is a neutral mode. So over here in the straight mode, you have to bring back. Again, then move upwards. Likewise, repeat in the initial phase 5 times. 5 times of upward and neutral movement. Upward and neutral movement. Then after completing, you can get your hand down. If in case you are feeling any pain or discomfort in your right hand, you can go with the left hand with the thumb pointing up, go downwards. The same slow and steadiness in the neutral position. From the neutral position, you can go to the down as low as you can. So again, till you are getting your image, the view of your thumb, you can draw your hand down, but not beyond that. Once the view is not in your visualization, just stop in that position and bring your hand to the normal level. Your eye should be fixed with your thumb alone, not on any other object. This way also you can move or without hand support. If you are comfortable enough, you can do it very slowly, only with the eyes of up and down movement. That is also applicable. You can do it that way also. It is not compulsory that with the hand you have to do or with the object you have to do. You can do without hand support also by keeping your head and body straight, and you can do upward and gradually neutral position, upward and neutral position. Then 5 times of completing that, go for downward. So this will strengthen the inferior and superior rectus muscle of the eyes. The same way after completing 5 repetitions of upward, then 5 repetitions of downward, go for lateral view to the right side. So taking your eyes or hand support if it is, take your right hand to the right side. This slow you have to take to the right side as much as the view is there, the thumb's view is there in the level. Till that level, you can take the right hand to the right lateral side and then bring it back to the neutral position. So take to the right and bring back to the neutral position. Likewise, 5 times. Complete with the lateral view to the lateral side of both the eyes to the one side. That is the lateral side. Then the same view, same thing with the left. With the left hand, you have to go to the lateral side. So this is lateral and medial recti muscle strengthening exercise. You have to take to the side and come back to the neutral position. Take to the side and come back to the neutral position. This will help to strengthen the lateral and medial rectus muscle of the eyes. And the same, now we are going for the oblique way, that is in the oblique direction. So from with your right hand over the left knee, from the left knee you will be taking it to the cross way, that is in the oblique direction, cross way direction you have to take. So starting with your right hand on the left knee, from the right left knee you have to take it to the right side upwards. From the down, from the down to the left, down to the right, up you have to take with your right hand. So this way again going up until the view is there, in the thumb's view is there in your visualization, you can take it to that level, not beyond that, and bring back to the left knee once again. So the same way you have to repeat 5 times. After completing this, that with the left hand you can go with the right hand, right thigh, and from the right thigh to the left side upward direction you have to go. So this is oblique on both the sides. You have to complete each side 5 times. So again, this will strengthen the inferior and superior oblique muscles of the eyes. So with these movements, we are completing, and finally we are going for the clockwise and anti-clockwise directional movement, where all the muscles will be involved to do this. So for this, You have to, you can use the help of your hands also to go for a rotational gazing, the clockwise or anti-clockwise movement, or without hand support, only with the eyes you can rotate completely also. With the hand support, what is the benefit is that you will, the eyes will be fixed properly with the thumb and you will get a complete rotation. Whereas without hand support, you may do a small circle instead of a bigger circle. You may do a small circle and complete. So the complete strengthening or the complete functioning of the muscles may not happen when you are doing without the hand support. That is the only difference. Otherwise, you can do with the hand support also or without hand support also. That's up to the people's comfortability or up to the people's complete functionality, we can say. So this is a second practice. First, we saw Chakshu Dauti, that is nothing but the eye wash. And the next main practice we saw is eye exercises. Now, a person is waking up in the morning. So first he did the eye wash. So with the eye wash, you can go for the work. By evening also, you can do with the eye exercises. Or after completing the eye wash also, you can do the eye exercises. Or one day eye wash and one day eye exercise. Likewise, also they can repeat. It is not compulsory. All the practices, what I'm saying here, you have to do it compulsorily on an all the day basis. You can do it on alternate days also, in case if you are having a tight packed scheduled work. Okay. And the next third practice is the one of the, we can say, a dharana practice in yoga. Will say one of the beautiful dharana practice. So to improve the concentration and the attention, we normally suggest this practice. At the same time, for doing this practice, eye muscles and the eyes are highly essential. Without that, we cannot do nothing but the practice named is Trataka. There is gazing a particular object, or we can say gazing a in simplified form or a very potential form we use is the tool we use is a candle or a lamp light, you can say. So the procedure for this is you have to keep your head and back straight. You can sit with your back erect in any perfect meditative pose or comfortable meditative pose according to you, or even you can keep your legs straight, lean on the support of the wall and practice also. But the flame or the lamp light should be at your eye level after sitting down. It should not be down or it should be more high in the high position. It should be at your eye level after the flame is lighted in the lamp or in the candle. The flame should be at your eye level, not the lamp or the candle. It should be at your eye level. The flame of the lamp or the flame of the candle should be at your eye level. So that way you place. After placing this accordingly, you have to close your eyes and relax your normal breathing, relax your whole body with a normal breathing. Then you have to open your eyes and start the procedure of gazing. There are several procedures available, like moving from the place down closer, going closer to the lamp and seeing the lamp, and finally closing the eyes and concentrating and just visualizing the flame or the oval shaped flame in your eyebrow center. That likewise, several practices are there, several procedures or techniques are there according to the various schools. One of the very simplified practice which we used to give to our students, which we used to give to our patients, and the patients also felt very easy along with gazing this. We used to mix the chromotherapy in this and take the Trataka session. So people used to enjoy that. People really used to feel the real essence of the practice. In that way, they used to do. So we mix chromotherapy and Trataka practice and suggest the technique to our students and the patients. So the same thing I'm explaining over here. So even you can do at your free time and try this and see. It will be very, very, what to say, your mind and body will be submerged by doing this way, the technique of Trataka. So what you have to do is that you have to light the flame, and the flame should be 2.5 feet distance from your eyes. Okay, after sitting from your eyes, it should be 2.5 to 3 feet at a distance. You have to keep the flame. Okay, then you have to light the flame. And main procedure or the precaution we can say is the people who are all not able to gaze the flame after keeping it at 2.5 to 3 feet distance. They are having a problem with that distance also they are not able to visualize. Then they can use the specs and try to see. Even in spite of wearing the specs also, they are not able to visualize this. Better they can avoid the practice. They can do other practices which are available in the yoga. Then they can try for this. And main precaution is that the persons who are using contact lenses, a fiber optic contact lenses, better have to remove the contact lens and practice, or better don't practice this Trataka practice with wearing the contact lens, because it is very harmful at times. At the period of completing the Trataka practice, the edges of the soft edges of the um, what to say that fiber optic um, contact lenses are getting slightly burned, and at times it is sticking to the eyes permanently. It may cause, there are chances of, may cause permanent eye damage also. Okay, so wearing contact lenses and doing protocol is very harmful, so don't do that. So wearing the specs is more ideal. That too, after wearing the 2.5 to 3 feet distance flame is clearly, if it is visible, very well and good. If not, go for some other practices. Better avoid the flame, because why means 2.5 feet or 3 feet distance itself, it is not visible for you. Even after, in spite of wearing the specs, you will end up with headache. You will end up with eye strain. The muscles will strain further. As I said, it is very delicate, so it will strain, and further it will end up with a headache. So instead of getting a benefit, you will get with you will end with a further extra complications. So better in both the cases, better avoid this practice. Other persons, any person can do this. So you have to light the flame. Now you sat on the floor in a comfortable position with your back and head support or straight. And now the flame is also at the level of 2.5 to 3 feet distance from the eyes. The flame is at your eye level in straight. So now the procedure starts. You have to close your eyes before starting the procedure. Then gradually, after your breath is normal, you have to open your eyes. And first procedure is that you have to gaze at the topmost part of the oval shaped flame. So the topmost part of the oval shaped flame, in case if you are concentrating sharply, okay, the flame and the other procedure, the room should be completely dark enough. Only the flame should be visible, and there should be no air supply, I mean fan or AC should be on. In case if it is there also, it should be mild, because the flame should not move. And the flame வந்து அலைப்பாயக்கூடாது. Only the procedure will be, the eyes will strain. If in case if the flame is flattering, the eye will strain furthermore. So it should be very less noisy and completely dark. Only the flame should be there in the room. In that atmosphere, you have to do this practice, Trataka practice. So in the first procedure, you have to, I mean, view, you have to see with your open eyes, completely open eyes, towards the tip of the flame, tip of the oval shaped flame. So you have to concentrate continuously on the tip of the flame for at least 5 minutes. We can say in the 5 minutes, how much less blinking you are doing, that much effective it is. ஸோ கண்ணை நிறைய நேரம் சிமிட்டாம எவ்வளோ நேரம் கண்டினியூஸாக அதை பார்க்க முடியுமோ 5 மினிட்ஸில், அந்த அளவுக்கு நீங்கள் எந்த அளவுக்கு பார்க்குறீங்களோ அந்த அளவுக்கு அது நல்லது. இட் இஸ் ஸோ பெனிஃபிஷியல் இஃப் யூர் டூயிங் தட் வே. ஸோ யூ ஹாவ் டு கான்சன்ட்ரேட் ஒன்லி ஆன் த டிப் ஆஃப் the topmost part, we can say, of the oval shaped plane. So the color, as I said, chromotherapy will merge with this. The color will be a light yellow color, you can see. You can say light or even white color, you will be getting the image at the topmost part of the flame. At times the flame flutters slightly. Even if it is fluttering, you have to keep on concentrating at the top of the flame only. Your eyes should not move anywhere else. So, for example, after doing, you completed 5 minutes. In that 5 minutes of continuous opened eyes with less blinking, in case if you got tears also, no botherations, let the tears flow, let it go, no issue, no harm in that. Just keep on concentrating on the top of the flame without any hesitation. So after 5 minutes, you can close your eyes and don't rub or squeeze your eyes. Just take a small hanky or a towel, a soft towel. Just wipe the tears in case if it is there, and don't harm your eyes by pressing or by squeezing or by giving any unwanted extra pressures. So further it will harm the eyes. So better don't do that. Just wipe the tears from your face and keep the towel down or the hanky down. Then do slight palming, that is rubbing your palms, both the palms, firmly. And after firm rubbing, you will have a good warmness in your palms. Just keep that warm palms above your eyes by making cup of your palms. So this is the cup. It is not flat. If it is flat, it will press the eyes, give unwanted pressure. So you have to rub your palms, make cup of your palms, and keep the cup of your palms above your eyes. And feel your own palms warmness on your eyes. Just do this 2 to 3 times. Just keep it, feel the warmness, and again do it with closed eyes. Likewise, do 2 to 3 times. Then, after doing and completing 2 to 3 times of palming, be with the same closed eyes. Don't open your eyes. Palming should be done with closed eyes, not with open eyes. Again, so you gazed at the topmost part of the plane for 5 minutes, then closed the eyes and you did palming for 2 to 3 times, and again you are being with the same closed eyes. Now the second procedure is open your eyes and gaze at the center part of the oval shaped plane. So the same procedure of keep on continuing, keep on gazing for 5 continuous minutes without much blinkings, very less blinkings, and again here also the tears may fall. So no botheration, keep on going, continue and complete the 5 minutes. And over here, if you concentrate really on the center part, you will get a dark colored image, very dark yellowish, or we can say a dark blackish image you will get in center. So this is the image, the color you will get in the center. So keep on concentrating over that. And after completing 5 minutes, again same procedure, close your eyes and go for palming 2 to 3 times. And after palming, be with the same closed eyes. And the third procedure is that you have to open your eyes and gaze at the lowermost part of the oval shaped plane. At the lowermost part, if you keenly concentrate, you will get a blue colored image, a blue gaseous colored image you will get. Here, in case if you not got tears while gazing at the topmost part or even at the centermost part, but damn sure at gazing at the third or the lowermost part of the plane, where you will get a cool bluish gaseous image. Here, most of the people used to get the tears uncontrollably. So that's what I said. Where we or I, we can say, we used to combine chromotherapy, what we learned in the naturopathy, along with the Trataka practice, because the blue color image after gazing the topmost, that is a slight white or the yellowish color in the topmost, and in the center a dark black or dark yellowish image. Whereas in the lowermost, it is a blue gaseous image, mostly it will be visible. While seeing that, after seeing the dark images, going for a slight, light color or a cooling bluish color, the tears will fall heavily and it will give a cooling sensation to the eyes also at the last time. And in the last third procedure, we can say not the last, it is the third procedure. So much of tears you will get. No botherations again here. You will go on continuing for the next 5 minutes, and after completing 5 minutes of gazing with less blinking at the lowermost part of the flame, close your eyes and go for the same procedure of 3 times of palming. And after palming, do the same closed eyes. And here we complete the last procedure is that now you gaze the three parts differently. Okay, so three parts differently. Now you have to gaze the full image at a stretch. Now you have to open your eyes and gaze the complete oval shaped image at a stretch. No need to concentrate on the tip, no need to concentrate on the center or the lowermost. You have to gaze at the total oval shaped flame for 5 minutes with less blinkings. And this is the last procedure. After 5 minutes of continuous gazing, close your eyes. And the last one is for the last ending is you have to go for antaran, that is, go for fixing this oval shaped image, complete oval shaped image, which you visualize with open eyes for the last 5 minutes. That now you have to fix it in the eyebrow center and mentally you have to visualize that. So with closed eyes, you have to visualize that by fixing the oval shaped image in the eyebrow center and concentrate. So by doing this, the mind gets calmed down. Okay, the mind fluctuations calm down. The extra tears or the extra fluids or the accumulations, the waste matters or the pollutants in the eyes, all will drop down along with the tears, and a fresh aqueous humor will produce in the eyes. Okay, the humor, the watery secretions to keep always the eyes wet, it will produce freshly after this practice. So your eyes will be also your eyes will get a fresh look after this practice. Your mind gets more neutral in case if it is fluctuating more. And third main benefit out of this is your concentration, memory, and attention powers will multiply by doing this regularly. So these many benefits are there apart from only the eyes by doing Trataka. So this is the third practice, super practice we can say. So beyond this, there are several other practices also available in yoga practices to increase the power of the eyes or to increase the strength of the eyes or to keep the eyes healthy. But I selected only these three practices. Why means I had done several researches in this. In Chakshudauti separately I did. In Trataka I separately did. In eye exercises also I did separately. Now I'm combinedly doing these three in doing my present research I'm doing with this combination of these three practices. So by doing several researches with the youngsters particularly, not with the elderly people, with the youngsters, because those are the community who are, we can say, if in case it is sorry, you can just correct me. They are the people knowingly harming their eyes by seeing the mobile phones closer for a longer duration. Okay, and um, it's a fate for the last 2 years. We can say they have to compulsorily be with the mobile phones only for the online classes also. So the present generation is getting more harm with the eyes by using these electronic gadgets very closer. So most of the people, the present epidemiology research is also saying that myopia, that is a short vision, is prevalent more among the youngsters who are not able to see the farther objects very clearly when compared to the closer objects because they are always with the closer objects of mobile. So the researchers also saying that. So with this young population, the college students, I did researches on several these three practices separately, and now I'm combinedly doing the same practices like combining Chakshudauti, Netra Shakti Vikasa, and this Trataka combination. Individually also I'm trying, and combinedly also I'm trying, and I'm doing a pilot study, we can say, a randomized control pilot study with the miniature population I'm doing at present. That result is also coming very promising only. Benefits is very good after doing 30 days regularly. So that's why I selected these three practices and explaining here for the eye care through yoga. And beyond this, what are all the other practices we can do also? I have listed in the next slide. That is, you can do starting from again the Kriya. Jalaneti Kriya is one good practice which helps to cleanse the sinuses in the face. So it helps to cleanse the nerves and sinuses. So Jalaneti will be helpful again. And in case of asanas, all the balancing asanas is highly essential or helpful where the eyes are highly needed to maintain the poses. Like for example, Tadasana and Vrikshasana here I have mentioned. So to do these two poses, you have to concentrate at a particular point. You have to fix your eyes at a particular point to gaze completely. Then only you can balance the pose in the final position properly without any disturbance or without any movements. So for that, eyes are highly essential. So by doing these poses, the bodily muscles also will get strengthened, the spine also will get strengthened. At the same time, eyes also will, eye strength also may improve slightly. So these asanas will be helpful. And Nashikagra Drishti, that is nothing but the nose tip gazing. It is one type of mudra, we can say. So then Shambhavi Mudra, where it is eyebrow center gazing. So these two mudras also are time essential when comparing to eye exercises. This is a small part, a mudra we can say, which is essential to have the medial muscles to get strengthened. And then palming already explained. So whenever you felt any tiredness or a strain or any sort of irritation in the eyes or burning sensation in the eyes, you can do at anywhere, wherever you are. Just do palming, just rub your palms and place it above your eyes. So for 2 to 3 times, if you're doing this, that will relax your eyes very effectively. very instant practice, we can say. So calming also will be essential. Will be helpful. And Nadi Shodha Pranayama. Without pranayama in yoga, nothing will move, even asanas, kriyas, whatever. So in that, here I have mentioned Nadi Shodhana Pranayama, which by which we can balance all the things in the body. Like for in modern physiology, we can say it helps to balance the sympathetic and parasympathetic tone. It helps to in yogic philosophy, we can say it helps to balance the Surya Nadi and the Chandra Nadi. It helps to balance the right hemisphere of the brain and the left hemisphere of the brain, or the right nostril and the left nostril, or right side of nadis and left side of nadis, anything you can say. So nadi shuddhi pranayama, it purifies and balances, try to keep both the nostrils in a free flow. So this practice is very simple and powerful practice to help for all the conditions. And of course, if for all the conditions, why not for eye problems? Eye problems also it will help surely. And eye massage. This is not comes the yoga, the general practice, or in naturopathy, we used to say massage with a normal gingerly oil. A cooling oil will help to relax the eyes, helps to relax the tension, excessive tension around the eyes, helps to decrease the excessive heat around the eyes. So, doing eye massage, a gentle massage with your massage with your index finger and the thumb around the eyes, just around the eyeball will help you, not over the eyeball, not squeezing the eyeball. It is just the orbicularis oculi muscle. You can just press feather touch with the feather touch of your thumb and index finger with applying gingerly oil. I think good gingerly oil, non-heated gingerly oil will be more powerful to relax the eye muscles, the muscles around the eyes, externally, I can say. And next practice is sun gazing. Sun gazing not during the heavy sun time, the peak afternoon time. It is mostly in the morning sun rising time or in the sun setting time. It is very, very ideal to gaze the sun. Where you during the sun rising time and the setting time, you can see the yellowish orange colored image of the sun, which you can see with your eyes opened clearly. That sun ball you can see clearly. So that sun you have to gaze for at least from 2 to 3 minutes if you are gazing also well and good. After gazing externally, you can close your eyes and gaze also if you want. So that way you can do that whenever time permits you can do that also at times helping for increasing the power and the strength of the eyes, health of the eyes. Then morning barefoot walking on a green grass. This we are applying reflexology, which you are studying in naturopathy. So reflexly, it helps us to strengthen all the bodily organs by doing barefoot walking on the green grass. So again, it emphasizes on all the delicate structures, including the eyes. So morning barefoot walking on a clean green grass is more beneficial. And again, none other than the vitamin A, the rich diet, which are highly essential for the eye health is that vitamin A rich foods you have to consume, mainly all bright orange, bright colored fruits and vegetables are rich source of vitamin A, like lemons, carrot, beetroot, oranges, papaya, all these things, and green leafy vegetables, bright green leafy vegetables, everything are richest source of vitamin A. You can consume any one daily, that will increase your power of the vision. And avoid what you have to do is working in the dim light or in the very controversially, contrarily, we can say dim light also you should not work. At the same time, bright light also you should not work. And in moving vehicles, like reading the books or viewing the mobile phones or any electronic gadgets, seeing any electronic gadgets in the moving objects, like sitting in the car or auto rickshaw or in the two-wheeler or train or flight, better you can avoid. Don't read any book, hardbound books also, or seeing any digital objects also. It is not good doing that. And avoid uh, rubbing the eyes. This most of the people used to do now. So knowingly or unknowingly, they will not notice that end of the day or end of seeing a movie, their eyes will be so tired, fatigued, itchy, or burning. So after ending up of a travel, also they will feel the same effects. So immediately they will go on rubbing or squeezing the eyes. That already it is in a delicate structure. It is a delicate structure. It is burning, itching because of constant work without any much relaxation in between. So again, if you are squeezing or rubbing the eyes, it will further harm the eyeballs. So better don't do that, and instead try for the practice which I mentioned in the fourth, that is palming. Palming you can do, that will relax, or you can do eye wash, that also will relax. So these are the extra measures apart from the main three measures. So in case if you are skipping that three measures, at least do few of these also will help you in a limited way. But those three measures, yogic measures, are highly powerful in daily basis. If you're not having any time to do all the three together in a day, at least try for one in a day. That will be helping you to rectify your problems in case if you're having, in case if you're going to get, you're in a risky state, in a borderline state, you can avoid. In case if you're healthy always enough with your eyes, you can sustain, you can maintain your eye health further for a longer duration. So this is the yoga, yoga for health, eye care in a nutshell. I have explained here. So being a online platform or online webinar or a lecture session, you not be able to take the practical session over here. Otherwise, all these three things you can say chakshudauti, that is eye wash. Completely, it is a practical subject where you have to learn it in practically. So I have mentioned only water over here. So we used to do in milk also a clear non-clothed milk, yeah, highly boiled, boiled and cooled milk also we used to do, cow's milk also the same eye wash cup, eye wash, chakshudauti we used to do, or else even in trifla water also we suggest the people to do to further get the benefits very faster. So because of the the lens behind the eyes, it is made up of really the protein. It is a protein layer structure, the lens behind the eyes. So when there is protein energy malnutrition, that time also there are eye problems happens. Okay, so to compensate that, we used to say to do chakshudauti, that is eye wash with the help of milk, to have little protein, very minute way it may absorb through the eyes. So for that, we suggest through the eyes, and to calm down very fast, to cool down the eyes very fast, and also to seal the damages, seal the redness or damages happened in the eyes by constant working of the eyes. We suggest with the tripla water, because with the tripla water, what's the benefits already, those three phalas will helps to cleanse, it helps to clear the ulcers, to help to heal the wounds, the micro injuries anywhere in the body. So that powerful it is, the three palas. So with that water, when we are suggesting chakshudauti, it helps to heal the micro injuries in the eyes very faster. So these are the three practices: chakshudauti, eye wash, and eye exercises, and trataka. In case the person is doing one in a day, also will be is more powerful, and they can get the effect within. No, I'm not assured within a week, because even in the research what I did and I'm doing also, I'm doing for a month. So no medicines or not a medicine. These are all not medicine. These are all external applications, we can say, or external practices. To get a good result, at least some 1 to 3 months we need time to get the improvement or to get a prognosis. So in my research, I applied and I got the result, a slight result also within a month, not within a month, after a month of assessment. So try for at least doing a month, then try for the difference. Try to check for the difference. Damn sure you will see much difference with your eyes by doing these practices, even the practices which I listed in the last slide also. So hope this session helped you a lot. Overall, heard or seen the session might have got some knowledge, because these are all practical sessions which you have to take deal practically in person, but that may not be able to for all. So if time permits, we can arrange a session or like a small workshop or a conference in future, along with the collaboration of the organizers. So till then, this may be helpful for you to have some knowledge. You can try this, then only you will get the improvement or changes. And any doubts, you can ask me now.
Thank you, sir. This was an really an amazing session. Hope this will be very useful and many of us will practice this and we will get many helpful. And if there is any doubt, you can do it in the chat box. You can send your doubts in the chat box. Sir, we got a doubt, sir.
Yeah,
Can we find effective reduction of power of eyes using yoga? Like they have said in myopia and hypometropia, we can find reduction of power by using yoga.
yeah, by doing this, I am getting results. I'm not saying that with a person of age 70, it is giving improvement, but with the persons, as I'm practically doing here in the research, and I observed, I got the result also between the age of 13 to 27. I can say 27, not 27, also 28. From the age to 13 to 28 years, I did research. For them, I got the results. So my research has yet to extend to the other age groups also. Other age groups I don't know, but this age group I'm really getting the compromising results. Few people they removed even the specs. Few people they got the percentage of the percentage of vision is getting improved from minus very less minus to normal neutral or very plus to the normal. So that way their eyes are getting improved. And the first and foremost symptom reduction they are getting is that their eye fatigueness and the eye soreness as well as dry eye syndrome is vanishing immediately. Within a week, they are getting rectification from these issues. Because this age group 13 to 28, what I'm saying is mostly they are in the learning phase or in the college or school phase. So these people mainly complain of dry eye, they are having itchy eyes, they are having burningness, burning sensation in the eyes, and the tears regularly falls. So these problems are getting arrested within a week, and gradually after continuously doing these practices within a month, I mean after a month, they got around we can say some 60 to 70 percentage they got improved. So I can promise that myopia and hyperopia, the short sight and the long sight will improve between this age group. I don't know about the other age group that I have to do research. I have to assess by applying these practices to them. Then only I can say.
Yes, sir. This will be this will be very useful for teenagers like this, sir.
Yeah, of course. Teenagers, it is really useful. They are really getting much help in this.
Yes. Sir, now cataract is coming even in young children, sir. We can reduce that using yoga, sir.
We can prevent, but we cannot I'm not sure about curing the problem by doing yoga practices, the cataract. In case if it is severe, they have to go for a medical intervention, that is surgical intervention only, but we can prevent. I can assure that by regularly doing these practices, they can prevent from getting cataract or glaucoma. So that is that.
Yes, sir. Sir, along with medications, we can even do the yogas for
There is
preventing.
no contraindications, no side effects, nothing else. They can do along with the medications also. People used to take diabetic medicines or hypertensive tablets, or certain times for direct eye problem itself, they are taking medicines, some external liquids or internal medications they are. Along with that, they can do this. There is no harm, no side effects, or any cross reactions happens. So they can do with this, no issues.
Yes, sir. Thank you, sir. We have another one more question, sir.
Hmm.
If we're practicing Taraka without specs and getting a blurred image, should we continue without specs or should we practice with specs only? If we can get a clear image with specs.
No, once again, please.
So they have asked, without specs, if we practice Taraka,
Hmm.
we are seeing blurred image, then we can do it with specs.
Yeah, they can do with specs, no issue. So they can do it with specs. In case that 2.5 to 3 feet distance flame, they are not able to view, or the flame is not visible without specs, they can wear the specs and do. Even after wearing the specs, if the flame is not visible, then better they can avoid the practice.
Yes, sir. And there is another question. Can this exercise be helpful for UVA problem?
uveitis problem, actually, to be say, in books, it is mentioned as literature review books they have mentioned, and there are very limited researches are available for the uveitis problem with yoga. There is no much proven or compromising research is done yet. In literature, it is given that it is good doing, particularly doing eye wash, that is Chakshudauti with the help of Tripla. Doing that is helping a lot. But in practical, I haven't seen much compromising results till now because very few patients only I got to my clinic, I mean, to our hospital or clinic. And the research papers also not that much in that. So it is unexplored, not much explored area, not unexplored. It is yet to explore in a wider way. So I'm not sure, say sure that it will be helpful.
Yes, sir. Thank you so much, sir. Wishing you all success in your researches, which will be very useful for the upcoming generation, sir, from the IS Ayush team. And we are eager to hear more interesting sessions like this from you, sir.
Thank you so much, and thank you for the organizers also for giving such a wonderful session and a wonderful topic, which is so close to my heart because I am doing this in this topic only from the last 8 years, 8 to 9 years. I'm doing researches on this particular topic only, and I'm glad that I shared here to all the people in the research perspective also, in clinical perspective also, and hope people will do and will get the benefit out of this also. Thank you.
Thank you so much, sir,
Thank you.
for making this our grateful. Thank you,
Thank
sir.
you. Thank you.
You can see, you can also see this video in our FB page, which will be available in I Ask Ayush. Thank you for all. Thank you for watching this.